Colin Furness. He's an infection control epidemiologist and assistant professor at the University of Toronto. And he will hopefully come back after, too, if we need to talk to him and help us understand more the numbers. Good to see you again, Mr. Furness. Let's just leave where Catherine talked about there, the fact that we are seeing what I think, I don't know if they are hotspots or flare-ups, however we want to characterize them, places in the country that have had outbreaks. And how important is the response to those kinds of things? How worrying do you see some of these cases, whether it be Windsor, Essex, or in Kingston, for instance?
There will be flare-ups. That's the word I like to use because it doesn't have to accelerate all the way to an outbreak or even to hotspot. Those are pretty intense words. They're going to happen for two reasons. One is that there is still circulating COVID. There just is. And it's simmering, it's underground, but it will pop up from time to time. Also, there is increasing travel, which is extremely concerning to me. But travel explains the New Brunswick cases. Certainly travel explains the Windsor-Essex cases. So we've got both of these to contend with, and they're a fact of life at this point. No matter what your track record is as a town or a public health unit, there will be flare-ups, no question.
The other thing we were discussing out of these numbers that we've seen on the Public Health Agency's website today is that, yes, the highest number of cases continues to be in that age category of over 80, but now there are more cases in the category of young people, 20 to 29. That to me seems very worrying, even if it doesn't lead to death or very serious cases. What do you think is going on there?
I think back to when I was in my 20s and how I would have managed my own behavior during this time. I think I would have likely, to be honest, constructed a little logic, a little narrative to myself that says, I'll be okay, I'll be safe. I'm not causing anyone any harm. And so I think, I'm not really expecting anyone else to be any better than me. I think that people in their 20s are very interested in socializing. Social life matters a lot. I think the lockdown affects people in their 20s very heavily when your social life matters that much. And so I think there's been a lot of rule breaking. And I also think that 20-somethings generally will look at the statistics and say, this is just going to be a cold for me. Yeah. Worst case, if I get it, it's not going to be so bad for me. Of course, they don't necessarily realize that they may get it and spread it and cause a lot of suffering and death without realizing it. So it's invisible, and it's really hard to protect and to change your behavior when something's invisible.
Yeah, I was going to say, I mean, the fact that you know that you are unlikely percentage-wise to die from it and unlikely even to get severely ill probably allows people in that age category to be, as you say, and I probably would have been the same, to not always follow the advice as closely as they should.
Yes, I think that is what we're seeing. However, if enough people in their 20s get infected, you will see complications, you will see severe cases, and you will see death. And I'm really hoping we can avoid that.
Let me ask you about the United States, because we talked about that a lot off the top as well. There's now, I think, more than 30 states that are seeing increase in cases. Obviously, some of these states have just reopened too quickly or are now having to dial some of this back. But when you think about the fact that the border remains closed till the end of July, it's hard to imagine it reopening anytime soon to recreational travel. But knowing we are in proximity to that kind of ongoing outbreak, what are your concerns around that? Because there is some travel happening. It's essential travel, but it's still happening.
It frustrates me that we have still not defined what essential travel is. If I feel self-important enough, I could say my travel is essential. We need to minimize it as much as possible. We obviously need trade goods. We need food. There's all sorts of things that need to cross the border, no question. There is some legitimate essential travel. If it's kept to a very small amount, then we can actually enforce the quarantine orders, the idea that self-isolation has to happen, and we're going to enforce that and track that. You can't do that with thousands and thousands, but you can do it with hundreds and hundreds. So we're going to need to keep that border closed. My guess is that it's going to have to stay closed for more than 12 months. That's not something people are talking about, but it's hard to imagine what's going to happen in the U.S. until we have a vaccine or until the population has been sufficiently infected that you have herd immunity. And to be honest, I think that's more likely.
Really? You expressed some concern just around travel. Do you mean travel within Canada as people sort of think about summertime and what they want to be doing? Do you not think anyone should be doing any travel at all? What are your thoughts on that?
I think travel can be done safely. If we're talking about domestic travel, international travel would not, if it were up to me, there would be no international travel that was not absolutely essential, full stop. And I see a lot of advertisements for airlines promising, as of July, to be flying people wherever they want to go. And I'm concerned about that. Yeah. For domestic travel, I am not at the point where I feel faith in our airlines' interest in public safety here. The ads I see and what I'm hearing from people around how full planes are, they can't operate at a profit and also protect people from COVID. And I'm afraid profit is going to win. And I honestly, it's not an easy thing to say, but I think airlines should be taking their marketing budgets and using that to mothball planes. We need to have less travel, and maybe one way to do that is to make it more expensive. It can be done safely, but it can't be done safely and profitably because you can't pack airports and you can't pack airplanes the way they're used to doing it.
Well, you saw, though, over the weekend that WestJet and Air Canada, well, I think it was Friday, both announced that they are no longer removing those middle seats, that they're putting everyone back in with no physical distancing, unless you call ahead and demand some extra space. They are not giving it to you anymore.
If it were up to me as the federal government, I would step in and I would impose a fee on tickets for the aisle and the window to pay for the middle seat, to make sure that it stays empty. It's a good example of the airlines, I think, acting in a way that I understand why they're doing it, because they can't operate at a loss, but I also think it's unacceptable to operate unsafely. I would worry that airlines would be subject to class action lawsuits down the road. There's nothing I can imagine worse than sitting shoulder to shoulder with a bunch of strangers for hours on end. That's how COVID moves. That's exactly what COVID is looking for. And I just don't trust airlines' ability to operate safely and at a loss at the same time.
Let me ask you one last question before I let you go. I appreciate you letting me pick your brain like this on TV. We have seen some increases in the weekly number of new cases per day in Alberta, in Manitoba, and in Saskatchewan. And I cite those places because Manitoba and Saskatchewan in particular had done very well for weeks and weeks. Saskatchewan's rate has now almost tripled, although it's still in a very small number of cases per 100,000. But when you see those upticks, and when people who live there see those upticks, how should they feel about them? How should they respond to them? It's normal, or we should be concerned, or how should they respond to those things?
It's a bit of both. It's to be expected, but it is also very concerning. The big question I would have for those provinces is how on top of contact tracing are they? Do we know where the cases are happening, and can we shut that down? I worry about workers in hair salons, for example. I worry about grocery store clerks. There's a lot of people with occupational risk I worry about. I worry about restaurants and bars and patrons as well. There's a lot of places we can point to say that's risky. If we actually collect the data where people are getting sick, then we can design interventions to make that stop. So it's not the number of cases, it's not even the rate, it's the knowledge of where the transmission is happening, and can we then enact interventions to make that stop, and can we do that quickly? That's what matters.
Yeah, well, when you see what's happening in Kingston at the nail salon, one person infected, now it's 26 people, and now they're contact tracing 3,000. I mean, that does give me some reassurance that they're able to test that many people.
That's exactly how to stay on top of this. That's how exactly to keep the second wave limited to small local outbreaks. I think personal care services are the new canary in the coal mine. Used to be grocery store workers when there was a lot of community spread. Now it's going to be people who are doing close face-to-face work. Dental hygienists I worry about, but I know that they know how to protect themselves. But hair care workers, nail salon workers, maybe tattoo artists, people who are up close. Occupationally, that's where I'm extremely worried, and we should be doing random, proactive testing of those groups.
Yeah, okay, Mr. Furness, thank you so much for making I'm supposed to call you Colin because you don't like to be called Mr. Furness. So Colin, thank you so much for making the time. I appreciate you letting me pick your brain on all that stuff very much. Thank you. Colin is an infection control epidemiologist and assistant professor at the University of Toronto. Colin Furness.